Yeah, good evening, everyone. Welcome to Lighted Red Postcard Series, a joint initiative by Voice of Healthcare and Natco Team. A Lighted Red is a postcard platform dedicated to spreading awareness, sharing stories, and bringing hope to everyone impacted by blood cancer. Every year, you all know, every year millions of people around the world are getting affected with this, diagnosing with these conditions like leukemia, lymphoma, and myeloma. Yet too often they ignore the signs and symptoms. So today we have Dr. Arijit Bishnu sir, a renowned hemato-oncologist and bone marrow transplant physician from Desun Hospital, Kolkata, to understand and explore what actually the blood cancer means, and he's also with us to share his knowledge on diagnosis, treatment in blood cancer, and also the evolution which has happened from last decade in blood cancer. While talking, we'll explore our how this multidisciplinary care. Anyways, he's with us to support and explore what actually it means, and also the clinical research is shaping in future of blood cancer therapy. It is always honor to have with you, sir. You with us, sir. Thank you very much. In short time, you have came to this platform to share to give us light and also throw some insights on the blood cancer, sir. Good evening, sir. I'm Sundeep Akula. Thank you, sir.
Good evening, Sandeep. Thank you very much for having me. And before we start, I would like to wish everyone a very happy Durga Puja and a very happy Navratri.
Thank you, sir.
So it is always a pleasure to be on shows where we talk about awareness, because more people are aware, half of the work is done. So because earlier the diagnosis is made, we can initiate the treatment early, and we can have better outcomes whenever things are early. So thank you very much.
Okay. So we'll start with the basics and awareness, sir. Actually, what is blood cancer, sir? How it differs from other forms of cancers?
Now, blood cancer, if we have to see, like from other types of cancer, every organ can be affected by cancer. Now, since blood being a very spread out organ, I would say, unlike other organs, solid organs like lung, brain, intestines, stomach. So these are very localized organs, whereas blood is a very spread out organ. So blood can be affected by any type of leukemias, myelomas, or the lymphatic system, which is also part of the hematolymphoid system or the blood. So that when that get affected, it also results in blood cancer called the lymphomas. And every component of blood, like if you have the common components of blood, if you say are RBCs or the red blood cells, the WBCs or the white blood cells, platelets, lymphocytes, so every one of them can be affected, can form a malignancy, and each malignancy will have a different course of treatment and a different outcomes.
Okay, sir. So you have touched upon the each type of blood cancer, sir. Uh, but
Yeah.
who is at risk, more risk at this blood cancer, sir? Any age or anything?
There are two age groups which are typically at age risk of blood cancers. One is the elderly population, who can be affected by various kinds of acute leukemias, chronic leukemias, myelomas, and lymphomas. But like all other cancers, solid, even solid cancers, children are at risk of blood cancers, particularly with the younger one, particularly in the age group of 1 to 10. They can also have specific type of blood cancers, not all type of blood cancers, but they are at a risk of having very specific type of blood cancers. Like B acute lymphoblastic leukemias are more common in children. Uh, Acute myeloid leukemias are less frequent in children. Uh, Chronic lymphocytic leukemia are never seen in children. Even if lymphomas happen, they are mostly of the Hodgkin's lymphoma type, which happens in children. unlike the non-Hodgkin's type lymphoma, which happens in the elderly population. Chronic myeloid leukemia is rarer in children. So different type of all types of cancer can happen in all age group, but the most frequent age group which affects all types of blood cancer would be the elderly population.
Elderly population. Okay, sir. And to understand the burden, sir, now you see the incidence and the trends. How does, how to say, what are the trends you are observing in the incidence of blood cancers currently?
Now, the trends which we see are almost same as to the published literature. The epidemiological study and the demographic study, which has been done worldwide, almost matches the pattern in which the patients come to us. So, there are two age groups which are getting affected. One is the children, mostly the children, then the elderly. Adolescent group gets affected by it, but it is on the lesser side of the numbers. For the children, again, acute lymphoblastic leukemias are very common. For the adults, acute myeloid leukemias are common. Chronic lymphocytic leukemias are mostly seen in adults, but the incidence I would say is almost 10%. Mostly at lymphomas or the lymphatic system, when it gets affected, it is non-Hodgkin's lymphoma, which the adult are more affected with. Children are mostly affected with Hodgkin's lymphoma, but again the incidence would be around 20%. And what we see in daily practice, mostly it is the myeloma which is very rampant. Like
Okay.
if I have to see, if I have seen 10 patients in OPD, including adults and pediatric, there would be one myeloma patient sitting. That could be a bias, that could be a bias definitely, but also uh, if I'm blinded to the bias, even then I would say myelomas are something which are uh, either getting diagnosed earlier, that is why we are seeing it more, or they are coming to us much sooner. So there is a increase in the number of myeloma patients in the elderly age group.
Okay. So when you talk about this myeloma, particularly the age group, you are saying that they are getting diagnosed earlier or increase awareness on myeloma or myeloma may be curable. But which age of myeloma is getting diagnosed, sir, generally?
So that again depend upon the population demographics attending your clinic. Like in my clinic, it is mostly the age group of 60 to more than 60 years of age. So I see a lot of myelomas in 60 to more than 60 years of age. Young myelomas are there. I would say the second age peak would be around 40 to 50, but it's mostly in the age group of more than 60 years.
Okay. Sir, what are some lesser known causes or risk factors for our audience to know for blood
To be
cancers?
to be very precise, there are no known risk factors for blood cancers. No one can predict that this individual will develop blood cancer. Yes, nowadays there we have certain tools which we can use to understand that whether there could be any risk or not. But again, they are not very defined, and provided that those changes will cause any damage to the blood system or hematolymphoid system is still very unknown. So now we have lot of mutations. We have understanding about a lot of mutations, which again have are found in patients with blood cancers. And when a lot of studies have been done, they have been found in patients with uh, less amount of hemoglobin, less amount of WBCs, less amount of platelets, and also in patients in whom there are no problems at all. So this clonal hematopoiesis or the mutations present, we call
Okay.
it clonal hematopoiesis. So this clonal hematopoiesis definitely has a role to play in blood cancers, but how precise it would be to predict that these people will develop blood cancer or not, it's difficult. Yes, there are some known mutations uh,
Okay.
which when present, particularly in the families, they make it very risky for the patients that they might have or develop blood cancer at a later age. Like for example, recently I would say I had a father visited my clinic. He is a 70-year-old gentleman suffering from AML. He has three sons,
Okay.
and one of them has already been diagnosed with AML earlier 2 years back, and he had undergone treatment followed by a bone marrow transplant. His father was affected later on. So when I did a genetic analysis of both the father and the son, there were few common mutations. And when I did the genetic mutation study of the rest of the two sons, these mutations were also found in the other two sons
Okay.
who have not developed the cancer yet. But definitely, since these two have a problem, I'll definitely keep a lookout on them. But I cannot definitely say that they will develop cancer or aplastic anemia or any other hematolymphoid problem. So that is the difference. We may identify the cause, but whether these causes will result in an effect, we are still not very sure.
Okay. So particularly the mutants may be in the family history. That is what you're uh,
Yeah, it may in the family histories, it may
trying
be
to. Sir,
otherwise in
hello.
the general population also.
Sir,
So
can
we
you
have
hear me?
identified few. Yeah, yeah. That's what I'm saying, that these mutations can run in the family or also can be present as a sporadic event in the normal population, which
Sir,
are,
can you hear me?
yeah, I'm able to hear you. Are you able to hear me? Hello? Hello? Am I audible? Am I audible? Hello?
No,
Yes,
sir.
yes,
Hello.
you are audible.
Okay. So these mutations may be present in the families or may present in general population. So we have identified the mutations, but how far these mutations will result in a cancer, we are not very sure. So definitely we can identify groups of people who could be at risk of developing cancer
No,
and increase the surveillance of these
sir.
patients.
There is a some disturbance. Now is fine, sir. Actually, sir, Rahul or Sandesh, anybody?
You are not audible, Sandeep.
Sir, he is joining again. Please wait.
Yeah, yeah, okay.
Yeah.
Sir, actually in Hyderabad it is raining heavily, so the net is not stable. Sorry for the inconvenience
Ah,
caused from me.
that's what something is happening.
Here it's raining heavily, sir. Sorry for the inconveniences. So we were talking about the family mutations. You have explained the story of that person who has three sons and the same mutants, and the research is still on. But when we talk about this early diagnosis and screening, sir, is it so very important to detect early the blood cancer, sir? Is it crucial
Yeah,
for the blood cancer?
yeah, it is very important because again it depends upon the disease type of disease, but mostly what is seen with acute leukemias is that patients become very immunocompromised very soon. So it is not because of the disease that they are at risk, but because they are very prone to infections. And soon, when the cancer replaces the bone marrow, the healthy these patients do not have healthy red blood cells, platelets, and WBCs. So they result in very severe anemias, very severe thrombocytopenias or decreased platelets, because of which again they are transfusion dependent. And by the time things are diagnosed, if it is late in the course of the disease, they develop severe infections. So when we start treating them, the problem lies whether to treat the infection or the disease, because if we start treating the infection, the disease will stay, and again you are falling into a vicious cycle. So the rate of complications, the rate of death due to treatment increases. So when the complications are less, when the effect of the disease is less, at that point of time, if we start treating, the prognosis can be improved.
Okay, at that time. Okay, sir. So it's very crucial, sir. Thanks for explaining. And sir, is there any early signs and symptoms uh, people should be aware of? Early signs and
So
symptoms.
what I always tell my patients that there could be very non-specific signs and symptoms like fever, frequent fever, recurrent fever. Patient is having fever, it gets okay after a few days. Again, the patient is suffering from fever, or the fever comes at a regular time every day, but there are no other causes which his general physician is able to identify. Then there are areas of bleeding from very unexpected sites. It may be gums, it may be the nose, it can be from the anal area. There could be presence of rashes, very severe bone pain, sudden bone pain without any cause. So when this kind of very non-specific symptoms come, you should always visit your doctor, nearest doctor, and find out if you are suffering from cancer or not. Because these signs are not just specific to blood cancer, this could be non-specific symptoms of other type of cancers too. Very unexplained weight loss, unable to eat, loss of appetite. So these are very non-specific symptoms, but definitely you should visit your consultant doctor to find out or to rule out whether there is any kind of cancer or not. This is one. Second thing which I always tell my patients who come for a general visit, that repeat your CBC. If your CBC is all right, repeat it at a frequent interval. It could be 3 months, it could be 6 months, but repeat your CBC and see the trend of your counts. If your WBC count is persistently increasing, or if your hemoglobin is persistently decreasing or increasing, your platelet is persistently changing, then you should find out the cause to it. It is never like that you have anemia, you corrected the anemia with a blood transfusion, and now you are okay. This could be subtle signs that you may have started developing any kind of blood disorder. I would not say blood cancer, but definitely any kind of blood disorder which needs immediate attention. So, and as clinicians also, we have to avoid the umbrella cover of treating things symptomatically. We should find out the
Okay,
cause and then treat it.
okay, sir. Okay, sir. And when we talk about treatment and innovation, sir, which is a very important part of our today discussion. So, how far this treatment has been evolved, sir, last 20 years, because you are into the expertise into this. So, how far it has been evolved, sir, in blood cancer treatment?
The treatment has evolved a lot and it is evolving a lot. There are so many new group of drugs which has revolutionized the treatment of blood cancers. Uh, if I would say in the recent times, CAR T cell therapy has worked wonders for patients who are not able to achieve remission, who have not been able to cure with any kind of treatment. And Currently, it has been awarded the invention of the decade by even the Indian government. So it is such a big invention that has happened in the medical scenario. And it will not be long that very difficult to treat other type of cancers, maybe solid cancers, brain tumors, can also be treated with CAR T cell therapy. So this is the newer form of cellular therapy. Now, second are upcoming immunotherapies, which are targeted therapies. It could be monoclonal antibodies, monoclonal drug antibody conjugates. The specialty of this type of drugs is, unlike chemotherapy, they are very targeted. They act only on the cancer cells, so they hit the bull's eye only and not the surrounding. So the toxicity of these drugs is very less. Currently, what we see is patients, when they undergo chemotherapy or any kind of therapy, they have to be confined into their houses for long periods of time. They're afraid to go outside. They have multiple issues like continuous nausea, continuous vomiting, fevers after the therapy. The quality of life suffers because of the therapy. Now, with this newer kinds of therapy, patients will be able to continue their daily life activities of daily living without any problem. So the quality of life will be improved. The morbidity which comes with the treatment of many of the treatment will be reduced. And definitely these drugs are so well researched and well targeted that the outcomes has further improved. And the best thing is the hope is coming more. Earlier, there were so many lesser lines of treatment that you fail one line or you fail second line, you do not have a third line to go into. Now we have multiple lines of treatment. You may fail three, but you have the fourth one. You may fail the fourth one, you still have the fifth one. There is always an option available to do something.
Okay, sir. So you have touched upon this targeted therapy as well as CAR T cell therapy also. Sir, when does the
Hmm.
patient should undergo this BMT? When does you recommend for the bone marrow transplantation, sir? Can you please highlight on that?
Yeah, so bone marrow transplantation has very clear-cut guidelines. So first is all acute leukemias, adult acute leukemias, be it acute lymphoblastic leukemias or acute myeloid leukemias, they should undergo an allogenic bone marrow transplant. All kinds of adult acute leukemias. Okay. All kinds of high risk acute leukemias, be it adults or pediatrics, should undergo allogenic bone marrow transplant. For myelomas, we should undergo an autologous bone marrow transplant. Now, the timing of transplant may differ. Some prefer to do it early in the course of treatment, some prefer to do it later in the course of treatment or when the patient has relapsed. Now, the
Okay.
difference between two is ultimately both the treatment modality will have the same outcome at the end,
Okay.
which we call it, which we define by overall survival. So both this
Okay.
strategy will have both overall survival, same overall survival. But if we look at the progression free survival, then doing an early transplant gives you increased progression free survival. That is, the patient will have lived healthy for the first time for a longer period of time. So before the disease relapses for the first time, he will live longer. So that advantage we are getting when we do an early transplant for myelomas. And that particularly helps in a country like India where people may not be able to be fit for subsequent lines of therapy. Because if a patient gets diagnosed at the age of 65, in India 65 is an elderly population. They may not have the fitness to undergo a bone marrow transplant later on in his life. So we would be missing out on an option of treatment. So I prefer doing transplants early in the course of treatment. For
Okay.
lymphomas, any kinds of high-grade lymphomas should undergo autologous bone marrow transplant, and patients who have got relapsed refractory lymphomas, all of them should undergo uh, autologous bone marrow transplant. In some cases, patients who have failed autologous bone marrow transplant, they should undergo allogenic bone marrow transplant.
Sir, anyways, you have touched upon BMT. You have thrown some light and understanding on
Hmm.
that. But for a general audience to understand what is this auto and allo, sir? Any
Yeah.
donor differentiation?
Yeah. So allogenic bone marrow transplant is defined when the stem cells or the bone marrow for transplant is received from a donor. So there will be an external donor who will be giving you the stem cells or the bone marrow. So that is called an allogenic bone marrow transplant. Now this donor could be your sibling, your
Okay.
parents, or somebody unrelated to you, provided the proper kind of matching happens. So a special type of matching is done for this donors and recipient, which is called the HLA typing. So when there is a match, acceptable match, we go for an allogenic bone marrow transplant from these three sources, whether sibling, mother and father, or someone unrelated. Autologous is the bone marrow is there is no external donor. The patient itself is the donor. So
Okay.
what is done is that some stem cells is retrieved from the donor, from the patient, and stored under special circumstances. And when the
Okay.
patient is given therapy, these stem cells are used to rescue him. So there is no
Okay.
external donor involved.
Okay, sir. Thank you, sir. It's very clear. And so we talked about the treatments. So there are so many treatments evolved when you talk about target therapy, immunotherapy, CAR-T, and all well as BMT, sir. So these many treatments are available. That is the reason you can personalize the treatment based upon the
Yeah,
options or based upon the conditions of the patient, right, sir?
yeah, yeah.
And sir, in India, as you know, one thing always strikes in the mind, that is affordability and accessibility.
Hmm.
Because when we talk about accessibility, sir, how far a patient from tier 2 city, uh, uh, any message for tier 2 city for this to take treatment, how far, sir? And one more thing, affordability. How far these drugs or these immunotherapy is affordable to the patients?
Now, definitely, the newer forms of therapy are comparatively expensive than the rest of the therapies available. But thanks to good Samaritan companies like you always provide some kind of
Thank you,
patient
sir.
assistance program, and we are able to continue this treatment. But here again, we have to understand the dynamics in a way that these treatments like bone marrow transplant, CAR T cell therapy, or advanced forms of immunotherapies, they are like buying a car on with a complete down payment. You pay the entire price of the treatment altogether. And going ahead with smaller chemotherapies and then successive lines of therapies, it is like treating the cancer in EMIs. So if you see in the long run, with the quality of life, with the problem you come across over the years, you tend to spend the same amount of money. So if we see the financial dynamics, it's my personal view that over a period of 5 years, if you are undergoing treatment, relapsing, coming to the hospital 5 times a week, and then relapsing, again continuing treatment, going autologous transplant, then again coming back. So over a period of time, you would have spent the same amount of money. So instead, what I always counsel my patients that undergo the best treatment available, and then maybe you do not have to take the journey so long. You do not have to pull the journey so long. You may be able to finish your course of treatment early and go back to your normal life. You may not need to come back to me again ever in your life. So that is something we have to make them understand, because whenever a better option is available, they can have a better quality of life. Quantity of life may be increased with successive lines of treatment, but quality of life is important.
Thank you, sir. And sir, still, even though these many therapies are available and you are very confident that it's curable, all the types of blood cancer. So, but still, the cancer word itself has a some social side, mean to say mental impact, or because the cancer it's not only affect the individual but also entire family. Whenever
Yeah.
they listen to that particular word, that to blood cancer. So, how mean to say, how does you counsel those kind of patients, and what role would be the caregivers, sir, to
So care.
caregivers?
So one counseling part which I always do is one is definitely the financial counseling, because the journey is draining. The journey is draining. But what I always tell my patients, particularly patients who are very young, when they suffer from this dreaded disease very early onset in their lives, that they should get treated because there is a possibility of cure. And then
Okay.
when there is a possibility, when there is a hope, it is always good to explore. I may not push for a very advanced form of therapy in patients who are very elderly unless and until they want to do it because they have lived their lives. But definitely for the younger ones, it always makes sense to push hard and harder so that they can avail the best forms of treatment. Because the more young the patient is, the more better the outcomes are. That is very clear. All the studies, all the literature that we read over the periods of so many years, so many decades, all the literature will suggest early onset, younger patients, more chances of cure. Second is the second part of the counseling happens in how the caregiver handles the situation. One is the psychological part of it. That patient will become a little affected, impacted because of so many negative things happening in his life. And the first question when any trauma happens to us is why me kind of a question. So they have to handle that aspect of caregiving, that it is something, I would say, accident which has happened, but the good thing again is you get cured. You have to fight.
Yes.
Third is most of the complications in all kinds of cancer treatment that happens is because of infection. So you have to treat or uh, any cancer patient with utmost care in the sense of that very hygiene care, very hygienic care, allowing them to be mixing with other people without any kind of protection is something which is like bring on the infection to me. So that is something which has to be taken care of. Healthy habits, healthy hygienic habits is something which needs to be followed. Healthy feeding habits needs to be followed. Now healthy feeding habit does not mean that you have to eat boiled vegetables and boiled rice throughout the treatment course, but yes, you can eat a general diet which is a balanced diet, but yes, it should be cooked, it should be cooked in good materials, in a good way. It should not be leftover food which is just heated and served back to the cancer patient. So these are some instructions which I give to my patients' attendants.
And sir, one last, not the least, but strong advice or strong, powerful message for this blood cancer from your side, sir.
What I recently had a chance of visiting a art of living class, and there I happened to listen to a quote. It is not a quote, I would say a phrase kind of a thing. Uh, Life is a blessing, and living is a miracle. In between the two is hope. So till the time there is hope, there is a life which is a
Right.
blessing, and there is living which is a miracle. And we are lucky that we are able to give that hope.
Exactly. Thank you, sir. Thank you very much. The message and the way you have explained, you have made understand the whatever the audience participated today, to make them understand what actually the blood cancer means, and you have clarified each and every step from burden to the treatment and also affordability, accessibility, everything you have touched upon, sir. Thank you very much. In this Durga festival, also you have taken time for our audience. Thank you very much, sir. Uh, Thank you once again from Natco and Voice of Healthcare team, sir. Thank you very much.
Thank you, Sandeep, and thank you, Natco team. Thank you.
You
I'll
can
sign
end the
off.
session, Rahul or Sandesh. Sir, please.
Yeah.